Welcome to the FMP Essentials show. I am Dr. Yousef Elyaman, your host, and I am thrilled to have you here with us. Whether you're a seasoned functional medicine practitioner or just starting out on your journey, this show is going to be a go-to resource for mastering functional medicine and making a real impact in your practice and community. Thank you for joining us on the FMP Essentials show.
Disclaimer, the content of this podcast is for educational and entertainment purposes only and is not medical advice. Always consult a licensed healthcare provider before making changes to your health regimen. Views expressed by guests are their own and do not reflect those of the host or producers. No statements about supplements or products are evaluated by the FDA and are not intended to diagnose, treat, or prevent any disease. Listening does not establish a doctor-patient relationship. By continuing, you acknowledge and accept this disclaimer.
Now sit back, relax, and enjoy the show. Hello, everybody. Welcome to the FMP Essentials show. Today, I have a very special guest with me, and we have a very special topic. But first, I want to go a little bit into the FMP Essentials analogy. We look at the functional medicine practitioner as a fruit-bearing tree. And that fruit-bearing tree, if it has a trunk, and to us, the trunk is knowledge. And the more knowledge the practitioner has, the better the practitioner can serve patients and actually serve the community around them. Everest, welcome to the show.
Thank you. I love that tree analogy too. I'm a big fan of trees. We all need more trees in our life, so that made me happy. But thank you for having me. I'm so excited to be here and to talk about our special topic today of anxiety. I'm a functional medicine, functional psychiatric nurse practitioner, and love that we've become friends over the years. For all of you out there listening, Dr. E actually taught me when I went through the IFM training. So being able to then become a colleague and friend of his has been really special. But yeah, excited to just chat all the things today.
Awesome. So let's start with, you kind of mentioned a little bit, but let's start with your 76-second bio.
Yeah. So I am from Dallas, Texas. I was born and raised. I'm back in Dallas, Texas, but I've kind of lived all over since. I grew up, I was always kind of embedded in healthcare. My mom was a hospital social worker. My dad was a doctor. And so I grew up in that world, but very conventional medicine focused, which is great in certain times and places, but I never really had that functional background. I went to Princeton for undergrad and studied psychology and just had been really interested in the mental health piece. And then I did Teach for America and moved back to Dallas and taught bilingual education in elementary schools. And when I was doing that, I was working a ton with the special education classes at the school and knew that I wanted to go more into being able to provide more support for this population and really get more into the psychiatry piece of things. So decided to go back. This is kind of long story short, but a lot of things led me here. Decided to go back to get my nursing degree and then later my NP degree and specialize in psychiatry. And at the same time, I actually was sick with Lyme disease. And I was going from doctor to doctor. I'd seen all the specialists that my dad knew. Nobody could kind of get me better or figure it out until I found a functional medicine provider. She truly changed my life and taught me so much too, just about like, hey, let's take a step back and even just look at the foundations. Like, what are you eating? Are you sleeping? Like, what's going on in life, right? So through that whole journey, I was like, this is the type of medicine that I really want to practice and incorporate that into the way that I treat patients. So decided to also get certified in functional medicine through the Institute for Functional Medicine. I worked at different functional mental health clinics and then started my own practice. And I was kind of I lived in Nashville, then LA, and then moved back to Dallas to start my own practice and have been seeing patients since through my own practice. I have a functional psychiatric practice and some NPs under me. And then I also just recently started a general functional medicine practice where we also have providers and health coaches and dietitians. So it's been really fun to just be able to help teams grow and grow myself and then work with so many amazing patients.
Amazing. Love the journey. And For audience at home, you can see why I chose her for this episode. She has a background, she has that personal connection with functional medicine. And it's interesting. It kind of reminds me of when I first started. I didn't know how hard starting your own practice would be, and that kind of allowed me to start my own practice. And I was very conventional. I would actually make fun of functional medicine stuff, and man, thank God did start my own practice because I was able to find functional medicine, and I was able to. I'm sure if I was in a conventional practice, it would have been a lot harder to start implementing. But that doesn't mean, for those of you at home, that doesn't mean you can't slowly start implementing functional medicine. Because really, functional medicine is evidence-based and it is good medicine. And I forgot to mention in this show that this show is not only for the functional medicine practitioner, but it is for the functional medicine champion. It's for that person that is interested in functional medicine personalized topics. So we speak to the level of the health coach. So we're speaking to the level of the lay public that is interested in this. So please continue to share this episode. I'm sure you're going to love it. But let's go deeper in. Let's go into our topic today. Everest, tell me about anxiety and why is it that you chose this topic? We could have spoke about anything for our first encounter here.
Yes, I am so excited to talk about anxiety because it is one of the most common things that I see on a day-to-day basis. It's something that I think the majority of people struggle with, have experienced in one way or another. Now, that doesn't mean that necessarily they qualify for a diagnosis of anxiety, but we all know for the most part what that feels like. Um, I think it also is typically treated in a very conventional kind of one size fits all way. And there's so many different root causes of anxiety that we need to address to actually resolve the anxiety and to improve like our daily functioning in terms of reducing anxiety, bringing more peace to our life.
So you mentioned something interesting. I guess a couple of things. Let's unpack that. So the first thing is yes, I think most people have experienced anxiety in one form or other. But you also mentioned that they may not meet criteria for full blown diagnosis of anxiety disorder, but we all have some sort of anxiety type feeling. So and in functional medicine, we are looking at that spectrum. We're not just saying, hey, you either don't have diabetes or you have diabetes. We know diabetes will start with insulin resistance. Then they start getting higher blood sugar, and then they end up being diabetic. And we want to catch them early on in the spectrum. And I would imagine with anxiety, you're kind of looking at it the same way. There's a spectrum.
For sure, there's such a spectrum. And I love that prevention focused approach that you mentioned, because that's really what we're all about, right? Is one, reducing symptoms, but also preventing them from progressing, preventing further disease, further suffering. I think also a lot of people are told like anxiety is just in your head, get over it, or stop worrying. Like somebody's worrying and they're told stop worrying, or you're having a panic attack and somebody's like, well, just breathe, you're fine. And that's only going to make things worse, right? So to me, anxiety isn't just something that's in your head. It's a signal that something in your body is off balance, and we need to be able to address that to, like you said, make sure that it doesn't progress to something more serious.
Great. And one of the reasons I'm excited about this topic is because if they have those subclinical, we could call it subclinical anxiety. So if they're having a anxiety but not fully diagnosable, or maybe they just didn't see somebody to get diagnosed, it leads to all kinds of personal and health issues. Like when I think about the worst decisions I've ever made in life, I was usually sleep deprived or stressed or anxious. So then my brain wasn't thinking clearly. But I guess let's move into how do you, we can talk about kind of conventional, like how would you diagnose anxiety? And then maybe we can go from there. But now you were conventionally trained. So as a conventionally trained psychiatric nurse practitioner, how do you diagnose anxiety?
Yeah. So, in psychiatry, and this applies to anxiety, right? We are diagnosing using our diagnostic manual, which is called the DSM-5, currently called the DSM-5. And I like to say, just preface this with five being it's the fifth version of this, right? So we've had, and if you've heard me speak before, I probably kind of talked about this, but we've had five different versions of how we diagnose different mental health disorders. And so that being said, it's a little bit subjective in a way, right? This was created by a group of people that probably sat around a room and were like, okay, we're going to categorize what we're seeing with our patients and come up with ways to like create diagnoses. Now, that's not a bad thing per se. It's actually helpful because to be able to like categorize symptoms and then have treatments for them can be really helpful, especially as you're learning what to do, all of that kind of stuff. However, um, it's not always looking at the whole picture and it's not always relevant to every single patient, in my opinion. So conventionally, how we diagnose it is if you look up the diagnostic criteria, there's different symptoms. So things like maybe restlessness, excessive worrying, rumination, panic attacks, and it kind of goes into more and more of these symptoms. And if you have a certain amount of them um, for a certain amount of time, then you qualify for a diagnosis of like generalized anxiety disorder. And then within anxiety disorders, there's generalized anxiety disorder, there's social anxiety disorder, there's OCD. So there's so many types, and there's way more than that, but so many different types of anxiety disorders. So we can kind of categorize, use those symptoms, categorize what type of disorder you would fall under, and then the manual is like, okay, well, first line of treatment for that is X, that kind of thing. Typically for general anxiety disorders, they're treated conventionally using SSRIs, antidepressants, right? Um, and then there's just different medications you can use from there. Um, and obviously therapy and all of that is supportive as well. The other piece to that diagnostic criteria is it says at the bottom, and this is true for a lot of mental health diagnoses, like this cannot be due to other conditions, like particularly substance related or things like that, which is actually a really important piece because we need to also think about what other conditions or what other things could be causing the anxiety. Um, so that's kind of conventionally. And if you want, I'm happy to kind of tell you like my approach to diagnosing anxiety and how I kind of figure out like what to do in that case too.
Yeah,
Um,
no, I definitely, I would love to dig into that and just kind of commenting on what you said, that it is, you have a bunch of people that sat around and had to come up with a diagnostic criteria, which is great. It's a good starting place. Apparently they're at five versions of it, but it doesn't really help us on what's causing it, because especially if there's multiple causes that could lead to it, and if the approach is using SSRIs, which SSRIs allow serotonin to stay in the brain longer, then that would mean that if the main issue isn't the serotonin, then you're going to miss those patients, or they're not going to respond. Although I know I've seen, I don't know if you've looked at it, but I was looking at some research that was indicating that SSRIs might not actually, that yeah, they happen to make serotonin stay in the brain longer, but it might actually not be working by that anxiety, or they may actually be helping by stopping rumination, kind of shutting off that frontal lobe from overthinking about things. And it's not just the serotonin. Have you looked into any of that?
yeah, and another kind of theory behind it too is that SSRIs also have been shown to lower cortisol, that stress hormone. And so when we are, there's different levels of how our body produces cortisol, but If we're in that chronic fight or flight state and we're producing a ton of cortisol, we have like high cortisol, then SSRIs can also help in that way too, right? So we don't really know. And what's interesting is I remember going through um, like conventional schooling, and our instructors would even say, like, we don't really know why this is fully working. And we also don't know why it works for some people and not for other people. And I think that's where functional medicine can really come into play. The other thing that I forgot to mention too, conventionally, that we use a lot for anxiety is something called the GAD-7. It's like a screening tool essentially. So I do give that to my clients because it's really helpful to see what symptoms in terms of anxiety they're having. But yeah, again, it doesn't really tell me like, okay, where is it coming from? And that's where my deeper dive comes into play.
So GAD, how many questions is it?
I think 7.
Okay, so it's a 7. I'll use in our office, we like the DAS questionnaire. I learned about it first from the Institute for Functional Medicine. It's part of that toolbox. It's a Australian tool, and what I like is it's way more than 7. It's like a couple pages, but they fill out symptoms and then they get a score for depression, for anxiety, and for stress, and then that way I do think that these scores are helpful because even though a lot of them are going to be subjective, it gives us an objective number that we can look at. So whenever you have a treatment, they come back in and they fill it out again. It can actually show that there was some improvement that was happening. But I want to let's go over maybe what are the common symptoms of anxiety, and you guys at home, you can't be using this to diagnose yourself. Make sure you see a qualified healthcare provider before you think, but it could give you some symptoms. And remember, just because you have the symptoms doesn't mean you have the full-blown disease. But what are some common symptoms? And then maybe let's talk about what are some uncommon symptoms that we wouldn't even recognize of anxiety.
Yeah, so common symptoms are things like restlessness, feeling on edge, excessive worry. So even that rumination, or not being able to control the worry. You sent a text to somebody and you sent it to the wrong person. You're thinking about it all day long. Um, Getting easily fatigued. So even feeling that almost like wired but tired, like you're so stressed out, but you're exhausted at the same time and you're just kind of running on fumes. Difficulty concentrating. So a lot of times actually anxiety and ADHD symptoms will overlap, and people are misdiagnosed with one or the other. Um, and then, because if you're preoccupied, if your brain's preoccupied worrying about something else, it's going to be really hard to focus on things that you need to focus on. And when we're producing a ton of cortisol, that stress hormone, that's putting us into this sympathetic fight or flight state. And it's really hard to your body is preparing itself to get away from or attack a threat. And if that's what we're focusing on, it's not worrying about like, hey, I need to do my homework and focus on that. Also feeling more irritable, maybe muscle tension. So a lot of people will hold stress and anxiety in their neck or their back. Women hold it a lot of times in their hips, that kind of thing. Sleep disturbance is a huge one. So that insomnia, not being able to fall asleep or waking up really early in the morning. And yeah, so those are really common ones that I see day to day. The other side of things is you can also hold it a lot of times physically, which I talked about a little bit. What I'm talking about here is, and this isn't really as much like looked at in the conventional way of diagnosing it, but I see a lot of people who they're like, I feel my mind doesn't over worry about things, but I'm like, waking up really early. And when I wake up, my chest is really tight, or I'm just kind of going about the day, like feeling like I'm kind of holding my breath, that kind of thing. Also, some people have panic attacks and that can look different as well. And that doesn't always, it is rare that it's like every day. But that's something we need to think about, or breathing heavier or breathing way more shallow, things like that. Avoiding things can be another big one. And then and this is more for the things I'm talking about are more for generalized anxiety. You go into OCD and that would be something different. But even like skin picking, biting your nails, that kind of thing.
You could have some OCD like tendencies, but not full blown, right? Where you're
For sure.
And
Yep.
OCD is kind of like a way of getting control, right? You feel like
Exactly.
things are out of control, and then
Yes.
you're trying to get control, and then it just gets dysregulated. It reminds me, I work as the functional medicine director of the guest house Ocala, and early on, since its inception years ago, and I remember trying like wanting to like find out about it deeper. So I actually certified in psychological trauma with Judy Crane. She's one of the forerunners of trauma, and I remember going to these groups thinking I had no trauma, but it depends on how you define trauma. And I think the first time that I actually felt anxiety or depression was going to these, or at least acknowledging that I had it, is going and learning about it. But what we would do is we'd go like 5 days at a module and then go do another module for 5 days. And then we would mention our own traumas, and you don't have your phone on, so you can't like numb from that, and you're sitting there with all these people around you, and you're kind of mentioning some of your these feelings that you've never told anybody. And it wasn't till then I remember sitting in group, and I started to feel like my chest like short of breath. I actually thought, shoot, I must be having a heart attack. And what I realized was that I actually had not allowed myself to feel anxiety my whole life, because what I would do is my brain, I would just start diverting. So I would look for those I didn't know I was doing it, but I would run and eat, or I would maybe start an argument, or I would work. Workaholism was a big thing. So I'd work, 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 and I have my family growing up around me, and I'm like not a part of it because my brain is kind of into the work. And it wasn't until I was able to stop that and just sit and reflect and feel that I felt, oh shoot, this is anxiety and this doesn't feel too good.
Yeah. Yeah. Well,
So
thank you for sharing that too. I mean, yeah, I think that's so. I used to do some work as a consult liaison in trauma hospitals, right? So not in a psychiatric hospital, but a general hospital, and anyone that would come through the hospital doors would, if they needed a psych consult, we would go. And one of the common things we would see was what they called, and it may have a different name because I feel like this is a little bit of an outdated name. They were called pseudo seizures. Okay, so there's no like change in brain activity, but these people are seizing. And this was it wasn't like one person was doing this and doing it for attention and making it up. Like this was a thing that happened. And it essentially came down to anxiety. And, there were a couple like things that would predispose you to be more likely to have this happen. And it would be people typically that, like you said, like they never really struggled with anxiety. Um, overall were fine. And then they just started having these like pseudo seizures. And it was due to like somebody who'd maybe they had a history of trauma in some way, shape, or form, which most of us honestly probably do. Um, and they never really acknowledged anxiety. So they didn't really feel it. They never went to therapy. And so their body kind of repressed these traumatic things that had happened to them and these feelings that were happening. They just kind of shoved it down, not intentionally, it's just kind of how their body coped with it. And then also like a lot of stress going on. So that was the other predisposing factor. So, you've been kind of repressing things, you have this history of trauma, and now you're being exposed to more stressors. And the best way that I would describe this to these patients was, hey, we are like buckets. If you put a bucket outside, it's going to start to fill up with water. Even if it's just like, a little splash comes in, like somebody cuts you off in the road, that's a little stressor, but it still fills up your bucket a little bit. Or somebody close to you passes away, that's a big stressor, right? It starts to rain. Well, eventually that bucket's going to overflow if we don't release it, if we don't process that anxiety, if we don't process things that are happening. And so we need to be able to like work with therapists and, use healthy coping mechanisms to process what's happening so we can empty our bucket before it overflows. Because when it overflows, that's when we see, on the extreme side of things, like the pseudo seizures, but even a lower level, like you said, the heart palpitations, feeling like you're having a heart attack, or a lot of GI symptoms, maybe that you start having loose stools or stomach aches or food sensitivities, headaches, all of those kind of physical symptoms. So that's something that I've kind of seen quite a bit, and really kind of shows the connection between the brain and the body.
Yeah, I love that bucket analogy. Eventually, if you don't empty that bucket, eventually it'll spill over, and then you're
Yeah.
genetically predisposed to different ways of spilling over. I think that um, sometimes people, their brain just turns off when you say trauma because they think, and I was like this, I thought trauma was like a huge car accident or somebody, some sort of like being robbed at gunpoint or someone dying in front of you. But when I was able to understand that it was that, and I think the best definition I found is moments of perceived helplessness, especially when we were younger. That kind of changes the way that we interact with the environment. And then something will happen that will remind you of those moments of perceived helplessness. And then you get triggered, and then that can create anxiety or whatever, depending on genetics. So awesome. So let's get into functional medicine. So now you have somebody that maybe has full-blown anxiety disorder. Don't try this at home, peeps. Make sure you're dealing with a professional. But okay, they have those symptoms, or maybe they have some of these subtle signs that they have maybe some extra stress or anxiety, not full-blown anxiety. What is your workup?
Yeah, so I would say, I mean, my whole approach is to get to the root cause, right? Like, what is the underlying cause of the anxiety? And the way that I look at anxiety and, and depression and a lot of mental health conditions is not anxiety, you have, okay, great, we've gotten to the diagnosis of anxiety and now we know how to treat it. No, I'm looking at it like anxiety is a symptom or a group of symptoms that you're struggling with, and something is causing those symptoms. Whether it is, maybe an issue with serotonin, maybe it is your adrenals are all out of whack, maybe, whatever it may be, we're going to get to what is causing those symptoms and then how do we address that. So I really take a full um, functional medicine diagnostic approach. I was trained through IFM, so I have that background of like, let's go through the timeline from before you were born till now. What are your antecedents, triggers, mediators, essentially? And I have a full assessment that I'll do. So I sit down with the patient for a prolonged period of time, and we're going through like, when was the last time you felt well? When did things change? When did you start experiencing these symptoms? How quickly did they come on as well? Like, was this something that, you were 8 years old and then all of a sudden one day you woke up and you were feeling like this? Have they gotten worse? Have they gotten better? What's been happening in your life during those times? I also go through, are you a full toxin kind of exposure questionnaire in a way? So like, what types of toxins may you have been exposed to or you are being exposed to, what's going on with your gut health also, and then going back to like what are the foundations in your life looking like? What does sleep look like? Are we moving our body? What is a day of eating and drinking look like? When during the day does this anxiety get worse? What do you do for work? What do you do for fun? What coping mechanisms or mindfulness do you do? So I'm really looking at so many different things, even hormones, inflammation, other physical conditions that might be going on. I know before this, we talked a little bit about like hypertension, right? You and I did. So like that can even have a play in there, or blood sugar, insulin resistance, infections, really trying to get to like what with this specific person could be causing these symptoms. And then let's kind of treat that and see if this anxiety resolves. And most of the time, it honestly does.
Okay. So let's go back. So you do a timeline. With a timeline, it gives you some clues to some of the imbalances. And that's where I think what I think happens is people just think it's in your head, right? And that's why you had mentioned earlier, like they get the advice that although the intention is good, the advice of no, just deep breathe. Yeah, do some deep breaths, right? No, you're all right. You're good. You're good. Like that doesn't when somebody's fully triggered, like they're in a full panic attack, that ain't gonna help, right? That it's the brain is looking for what can kill it. It thinks that its life is in danger and it's just going to fight, it's going to repel that. But let's but I think the important point is that you can have a biochemical imbalance that can lead to a psychological, spiritual, emotional imbalance, but then you can have an emotional, spiritual, psychological imbalance that leads to a chemical imbalance. And it's not just like in their head, like they're making it up. It actually is creating things. The vagal nerve is going to is going to fire differently based on based on our environment. But also, you have bad bacteria in your gut, or you have some sort of a deficiency. Maybe you're missing nitric oxide. Maybe you have inflammation, and that's going to change things as well. That can kind of lead to that. But if you had to kind of break it down, so you do a timeline. What are some common tests, functional medicine tests that you'll do to see some of those imbalances?
Yeah, so kind of taking a step back of like, especially for you all listening who are um, trying to learn, okay, what do I do Monday morning to assess for anxiety, right? So I'll do a timeline, I'll do a full health history, even though we're looking at, somebody comes in with anxiety, I'm still asking about all the other things you would ask about if they came in with gut issues or whatever it may be. And then I'm asking specific questions. So I'm asking, when was the last time you felt well? When did this start? What's making it better? What's making it worse? How quickly did it come on? And then we're going to look at, like you said, what testing do we do? So there are different, depending on the person and depending on kind of what I'm seeing. And I'll try to kind of explain like how I decide which test and whatnot. There are some functional tests that I do like to use if that's like within the patient's means. Now, depending, functional tests are typically out of pocket and they can be expensive. So that's just something to keep in mind. It's not going to be an option for everybody, and that's okay. You can still do so much without them, but they can be helpful tools. So one of them can be a salivary cortisol test, especially if I feel like somebody's adrenals are all wonky. Cortisol, the best way to test cortisol is through a salivary cortisol test because your cortisol follows a specific curve throughout the day. If we just test a morning cortisol via blood, it can give some insight if like something's way off, right? If it's really, really high or really low, but it's not telling us what's happening with your cortisol throughout the day. And so it doesn't really give a picture into like, maybe their cortisol's spiking in the evening and that's why they can't go to sleep. Or maybe they're not achieving that cortisol awakening response where your cortisol is supposed to kind of spike after you wake up to kind of get you going, get you out of bed before it starts to slowly come down. And depending on what's off there, that can give me a hint of, hey, we can use these herbs or we can use these lifestyle tips at this time during the day to kind of like lower your cortisol or to raise it or to help you get that cortisol awakening response. So if that's kind of the approach I'm going for, that's what I'm looking at. Before that, though, I should mention I do like to do a comprehensive blood test, looking at, basic things like what's your vitamin D, what's your thyroid look like, are hormones normalized, even looking at hemoglobin A1C to see, like, do we have a big blood sugar problem? Obviously CMP, CBC, the basics, that kind of thing. Um, Looking at, homocysteine and B vitamin status and an iron panel. All of these things can lead, if they're off, can lead to symptoms of anxiety. Another one that I really like to do that's a pretty cheap, relatively speaking, easy way to assess for things that can really impact anxiety, because I see it being one of the biggest contributors, is somebody wearing a continuous glucose monitor for 2 weeks and tracking symptoms throughout that, which tells us what's going on with their blood sugar. So a lot of us are having major blood sugar imbalances throughout the day, throughout the week, and that will cause, it's not that it can cause, it will cause anxiety. So if we can regulate blood sugar, a lot of times that can make a huge difference. And I love the continuous glucose monitor because it allows people to actually see what's happening to their blood sugar when they eat certain things, when they're really stressed out, when they're doing, really hard workouts, all sorts of things. So we can kind of regulate things that way. And you can get one even out of pocket that's not covered by insurance for pretty cheap. So that's one thing. Sometimes I'll look at toxins, so maybe like a mycotoxin screening, or if I'm really expecting big toxin exposure, something like a total tox, that kind of thing can tell me. Or even looking at heavy metals in the blood, that sort of thing can tell me if there's some exposure. I will tell you, one of the most common things I see in practice in terms of toxin exposures causing severe anxiety is mold. So somebody who's living in like water damaged houses, or had a bad leak that they never fixed, or they're seeing mold, or even if they have a history of living somewhere with that, and maybe that's when a lot of their symptoms started. Mold, you have to pretty much detox it. It doesn't always just go away. So that can be something that we look into, and it can be helpful for patients to actually see the results of that, to know like, hey, I've got to make some changes. I've had people come from psych hospitals, and honestly, it was mold. We clear the mold and their anxiety finally goes away.
Amazing.
Yeah. And then,
So,
the last thing I'll kind of say, two
yeah.
things. One, the gut. So, stool tests or doing a full gut assessment can be really helpful. And then also genetics. So looking at genes like MTHFR, COMT, that kind of thing.
So just let's unpack that a little bit. So you mentioned just a general panel, like doing a CBC, a CMP, that kind of thing, thyroid. Just a couple of clues for the audience and for the functional medicine practitioners, or I'm sure if they've listened this far and they're a practitioner, they're converting. So we can do the conversion at the end. Just you can reach out to either of us on Instagram and we'll help you with the proper conversion. So you're changed over. I'm just kidding. There is no conversion, just for just in case people didn't get my humor. So for your thyroid panel, there's a little clue in the thyroid panel, the reverse T3. So you may have looked at their thyroid, or somebody went to their doctor and they got a thyroid test and they said their thyroid was fine. But if they didn't check a reverse T3, then that reverse T3, when it's high, it's actually a clue that they're under a lot of stress. And it could be physical stress, it could be emotional stress. But when I look at a ratio, a total T3 to reverse T3 ratio, and if that is too low, or then that's a sign that they're under stress. And then the other thing that I'll look at is, and this is conventional labs will do this. The other thing that I'll look at is I usually just check a total T3, but you can do a free T3, free T4 ratio. And that also can be can cause it. And I've been interviewed on like a full thyroid panel on our YouTube show. People can take a look at the podcast, look at where I was a guest, and look at when I talked about thyroid. The other thing you mentioned, I love that you're doing these glucose monitors, so you're watching and seeing what your sugar is doing, and cortisol will actually increase people's sugar levels, because when the body thinks that it is, when the brain thinks that the body's in danger, one of the reasons our Stone Age ancestors would be in danger is we're not getting enough food. And if you're not getting enough food, your blood sugar level can drop, and that could kill you. And that's if a crazy raccoon's trying to get you and your blood sugar drops, that raccoon will definitely be able to get to your ankles. The other thing, so the other, you mentioned the homocysteine, which is basically methylation, and that could be an indication that they have low B vitamins. And the low B vitamins, there actually was, I saw a study where they looked at people that ended up in the ER with generalized anxiety disorder, and what they found is that they actually had a lower B vitamins, and that's why I'll put people on like a methylated B vitamin with anxiety sometimes, especially if their homocysteine is off. You mentioned the saliva cortisol test. Could we talk about maybe the patterns that you see, that you most commonly see with anxiety? Because like you said, it starts high and then goes down throughout the day. Can you mention what do you see often with the saliva cortisol test? And that's
Yeah.
not that expensive, right? Is it about $100, right?
Yeah, it's really not that expensive. You want to get one, in my opinion, that shows it's called the CAR, the CAR, or cortisol awakening response.
Mhm.
Not all of them will test that, so make sure you get that because that can tell us a lot as well. And then with these specialty tests, just kind of to also take a step back, if you're like, I don't know how to read these, I'm new to all of this, they're awesome because the companies that you get it from will often do free consults with the provider to walk you through like what you're seeing and what interventions they would recommend. So don't be scared of any of the specialty tests. That's kind of a really great way to learn them, is to work with the company. But with a salivary cortisol test, so when you wake up, your cortisol, I guess I'll do it backwards so that if they're watching this, they can see it correctly. But your cortisol is kind of at a higher level, like when you wake up. And then within 30 minutes, it's supposed to increase by about 50%. That's your cortisol awakening response. It's kind of what makes you feel like you can get out of bed, that kind of thing. When people have a flat cortisol awakening response, they're the ones that are like, it takes all of my mighty energy to get myself to like get up and brush my teeth and get my day going. Um, some people wake up with a lot of anxiety, or they wake up and their chest is tight, right? And they're like, nothing's happened today. I don't know why I feel anxious. My chest is tight. They will start at a high anxiety, high cortisol level typically. So on that test, you'll see that morning cortisol when they wake up pretty high. And then, you have the cortisol awakening response, and then it slowly kind of like I guess a little quicker at first, drops back down, and then it really slowly like bottoms out. And you want it to not also be too low at any of these points, but typically when it's lower, sometimes it's anxiety. It's more like the really fatigued, lower mood type thing. So today, talking about anxiety, typically you'll see the cortisol higher. Now, the other thing that I see commonly is an afternoon cortisol or an evening cortisol being really high. Sometimes you'll see it high the whole time and you're like, all right, we've got to do just full on anxiety mindfulness work because all day long you're at this heightened level. But a lot of times when you see it like spike in the afternoon or spike in the evening, that can give us ideas of, hey, is there something really stressful going on at this point? Like, a lot of times I might see moms who, when their kids come home from school, their anxiety really spikes and they're like, I'm fine all day. And then I just like, I can't even deal with life and at 4 p.m. and I get super anxious and I'm stressed all dinner and then I start drinking and you see that presentation a decent amount. And then you also have people who are like, I can't fall asleep. I just get in bed and then my mind races, or I get the second wind at night and I just start like, that's when I can work. And if I try to go to sleep, I just sit there and can't sleep. A lot of times you'll see that higher cortisol at that point too. And sometimes that comes across to them as anxiety. Sometimes it comes across as that second wind, but it's still telling me your body's like kind of in a stressed out state and we need to work on managing that and reducing it so that your cortisol can follow that curve.
I wanna just advocate for all of us parents and speak for all of us. So any children, if you're watching, recognize what you do to us. You're driving us crazy. You're making us stressed. So, all right. So which lab are you using? This isn't CME. So what lab are you using to check the cortisol, along with the cortisol awakening response?
Yeah, typically I've been using ZRT,
Okay.
their their lab. There's a couple great ones out there. That's just the one. The other time, sometimes I'll run a Dutch test, which is a hormone test. And if I do the Dutch, I always do the Dutch plus, because it also has the cortisol with the cortisol
Awakening response.
response. Yeah,
So, do you have any affiliation with these companies?
no affiliation with them.
Okay, good, good, good. Even though we're not CME, I just want everybody to know any potential conflicts of interest. Um, I do have affiliation with the Institute for Functional Medicine, and actually, I speak for A4M and whatnot. I have affiliation for like just magnesium in general. So so y'all know, I really like magnesium. I think it really
I,
helps.
yes, and talking about anxiety, honestly, I don't even in my opinion, I don't actually even measure it anymore. You can always test a magnesium. I would do a magnesium RBC if
Yeah,
you're doing that to test for it. But in my opinion, most people are deficient in magnesium if they're not taking it, especially in the US, we have to get it from our outside sources. So if you're not taking it, you have to get it from food essentially, or like electrolytes or something. But
yeah.
our soil's so depleted in it that most people are deficient in it. And especially if you're struggling with sleep or anxiety or pain or whatever it is, magnesium is such a powerful thing to supplement with. And it's not really going to hurt you for the most part to supplement with it. So
Yeah.
it's kind of a go-to that I'll just start people on, and it can make a huge difference.
Yeah, unless they're like stage 4 kidney disease, I don't really worry about, especially the doses that we use. So, all right. So one more thing. One of the things that I'll check, especially when we at the guest house, the trauma center that I work with, we'll do a zinc and copper, and our office will do a zinc and copper ratio. And if your copper is way higher than zinc, even if they're within the normal ranges, then that high copper can like affect the brain. It can increase the risk of anxiety. It could also increase the risk of actually dementia. So I try to. That's another test. I don't know if you're looking at that, and that's just a regular serum test.
Yeah, yeah, I add that to my comprehensive panel as well. And I love that you mentioned zinc and copper. So just anyone that doesn't know, they have an inverse relationship. So I also don't want people's zinc too high either, or that will lead to different issues. But usually people's zinc is lower. And so that is something that can really impact anxiety, even depression as well, and irritability.
No, we don't use. I think now is a good segue into management, right? So we don't. We're now talking about rebalancing the system so that the body can do what it needs to do, so that the body can feel more regulated. We're not talking about these lifestyle or supplements curing diseases, right? So we got to be careful with our language, but we're talking about, all right, you have this diagnosis. Okay, you have these symptoms. How do we rebalance the body based on the imbalances that we found? So with that, can maybe a quick, what do you have them do when it comes to lifestyle stuff?
Yeah, so lifestyle stuff. I know you mentioned the vagus nerve earlier, so I'll kind of start there. Vagus nerve training, whatever you want to call it, is so powerful when it comes to regulating the nervous system, decreasing anxiety. So the vagus nerve is something that basically can switch us from a sympathetic fight or flight state to a parasympathetic rest and digest state, and can lower that cortisol, that kind of stuff. The vagus nerve, I think of it, it's not a muscle, but I think of it as like you have to train it like one. You have to do stuff consistently, daily, for it to be effective. You can't just do one of the things I'm about to mention one time and be like, it's going to solve all of my problems, right? Um, it's something that I've incorporated into my daily life that's made a huge, huge impact, but ways we can activate it. So, if we're thinking about like basic ways to activate the vagus nerve. One thing that does it pretty powerfully is hot cold therapy. I want to put a little asterisk next to that, particularly the cold therapy, because if you are in a very stressed out state, particularly if you are a female, doing like cold plunges and stuff like that is actually going to put you in more of a stressed state, and it might be too much for you. Someone once told me, and this is kind of what I go by, that was really helpful. If you, take a cold shower or you do a cold plunge or something, and your body can't kind of like get back to its normal temperature, feel like it's regulated within like 3 minutes, then it's way too much for you. So some people who are really, their body's in a stress state or you're struggling with an illness, you're cold for hours, or like 30 minutes, that's too much for you. But heat can be really helpful. So like saunas, Epsom salt baths also gives you magnesium, stuff like that. Other ways to train the vagus nerve is gargling. So you can gargle for like 10 to 15 seconds, 2 to 3 times a day. That can activate it as well. It's that vibration, humming, singing really.
Wait, Everest, show us how to gargle. I'm just kidding.
I don't know if anyone wants to see that today. Yeah. The other thing that people always laugh at me for too is technically activating, I don't really recommend this, but activating your gag reflex will do it too. So do not recommend, especially if you are on the queasier side. But if some people will do that as well a couple times a day. I have recently gotten, again, not affiliated with this, but the Pulsetto. There's a couple vagus nerve stimulation devices. And the Pulsetto is one of them that it's like a little headband. I should have brought it here, but it wraps around your neck and it has these like electrodes that go right here and they vibrate and they activate your vagus nerve. And it's awesome. You can sit there for, it connects to an app and there's different, you can put on the.
Yeah, let me ask you about that because I looked at the Pulsetto. There's a couple of them where you just hold it here. I recently had somebody try it and they said their neck was too small. I need to kind of look into it a little bit more. I have one here. I need to kind of open it up and kind of see what it's about. But that whole neck being too small, is that a thing or do they just move it?
So I have a pretty small neck too. Okay, two things. I got mine before they updated it and now they have one for small necks. So I haven't tried the new one yet, but the idea of the smaller one is that you don't have to hold it. Mine, I do actually just hold because if it's too big, it will like kind of just fall.
So you just have to hold it in place.
Yeah, I just hold it in place.
Yeah.
It's very flexible. So like it shouldn't matter how small your neck is. You can still get the same benefit. You might just not be hands off, which is fine.
But Everest, I like what you said. You said that the time to train your vagus nerve isn't when you're anxious. I like thinking of it like a muscle because if you are learning to get to use your vagal nerve and to trigger that vagal nerve, which is a good thing to kind of relax you, then when you actually do need to be able to kind of calm down, then you're going to know how to use it more. But if you're trying to figure it out once you're having a panic attack, that's not going to happen. And I'll tell you, some of my favorites are, you mentioned humming. So if people like to sing, if they actually gave themselves time to sing, but like really hit the notes, maybe 10, 20 minutes a day, something like that. And then in different religions, there's like chanting. And if you kind of learn the chants, even in a foreign language, a lot of them are triggering the vagal nerve. So if you took time to like do a practice where you're doing some sort of chanting, that all, and just add it to a spiritual belief that they're already part of, like they already believe. I found that to be helpful as well.
For sure. I love that. Yes. So any of that activation will do it for sure. And you look at, there's even a lot of yoga studios will do like classes with mantras and Om practices. And the way that works is actually through your vagus nerve in terms of how it physically relaxes you. There's a lot of other spiritual parts to that as well.
I heard, I don't know where I heard it from, but I heard, this has actually helped me. I don't know if, what your thoughts are on it. Yeah, I'm trying to remember because I want to. I'll put it in the show notes if I can remember where it came from. It might just be one of those universal things, but basically, it is when you're anxious, you have cortisol up, you have adrenaline up, and to just calm that down in the moment is not. It's just hard to do. You're already you have these hormones and these neurotransmitters kind of flowing through your system, and that if you look at being excited about something, you have the same sympathetic drive. Like you still, it's the same hormones floating around, but when you're excited, you add positive to it. But when you're stressed or afraid, you have negative. So for me, if I'm really just needing to get better, like in the moment, because sometimes you got to work, like you got to go see another patient, you don't have time to feel the feelings. So sometimes switching it and reminding myself, hey, what am I excited about? What could I be excited right now? And if I can bring myself to excitement to remember what I'm actually excited about, I can take that and run with it. So I don't know what your thoughts are on that piece.
I love that. Forever ago, I heard that excitement and anxiety share a lot of similar um, physiological responses, right? And that has been super helpful, but I've never really thought about it in that way of, I've thought about it when I'm excited about something and I start to feel nervous. So like even if
Yeah,
I'm going
shaky.
to, yeah, like if I'm going to speak at something or whatever, and I'm like, I'm so excited, but why am I so nervous? And then I'm like, that's what I tell myself. But I love what you just said. I think that's so helpful. And I think you have such a good point of like a lot of times we're already in the anxiety attack or panic attack state, or we're already really stressed out and it's hard to, the thing with the vagus nerve, that's a lot of times more prevention. But like, what do we do when we're feeling that anxiety? One of my favorite things too is activating your senses. So, especially, this is super helpful if you have access to this for panic attacks or just anxiety in general, but can you like hold some ice in your hand or start tapping on yourself? Particularly like opposite sides can be helpful. Or can you do, I love the exercise. It's super simple called 5, 4, 3, 2, 1. You name like 5 things you see, 4 things that you can feel, 3 things you hear, 2 things you taste, 1 thing you smell.
Mindful. Yeah,
Yeah.
getting in that mindful state. And I think we gotta also mention, I think we're both on the same page here of one of the problems is that you when we suppress our emotions, they come out, even the negative ones, and you just have to make time for yourself to sit and feel. Like when I start realizing that I'm getting triggered and I'm things are bothering me that usually don't bother me. Things are not funny that I usually find funny. I will realize I'll try to make a note of it, and when I get a chance, I'll sit and I tell myself, I know it feels like it sucks. It always sucked, and it always will suck, but it'll pass. It always passes. And I say I need to feel this because if I feel this, it will transform the frequency of my soul. And then I sit and I say, bring it, bring the feeling, and
Yes.
turn the brain off, stop thinking about it. Like Rumi's poem, The Guest House. Turn the brain off. No, I'm not allowed to think. All I can do is keep saying no, feel it, keep feeling, keep feeling. And that's really been a game changer for me.
I was actually like, that was the next thing that I was going to say. I love that you said that because we can't, two kind of comments on that. One, we can't fight anxiety. Anxiety will almost always win. So I think, and I've been guilty of this, a lot of times our common reaction is we're feeling really stressed or anxious, and then we're like, we have to get it to go away. We have to talk ourselves out of it. We have to get it to go away. And that's just going to put you in that spiral, right? So I like to even like sometimes talk to the anxiety, and sometimes I'll do it out loud of like, anxiety, I see you, like, hello, good morning. You're not comfortable. I don't enjoy you being here, but like, have your day. I'm going to go like make my breakfast, or, I'm going to go do this, and you can just hang out and you're going to go away when you go away. But like, I'm going to, keep on going. And that I think is more helpful when you have to go do something. Otherwise, it's like, let's kind of sit, acknowledge where this is coming from. Like you said, let's feel these emotions because that's super helpful too. And then just being able to like not to understand that emotions, like you said, are going to come. We can't control emotions. So I'm really big on let's focus on what we can control versus what we can't. Emotions are uncontrollable. You can't control that you're going to be sad when someone passes away. You can't control, you're going to be anxious when you have something big coming up or whatever it may be. So let's focus on what we do when we do feel that. Can we kind of sit with it and like process whatever's going on? Can we, focus on what we're excited about out of it? Like all of those things are things we can control despite feeling the emotion, the uncontrollable emotion of anxiety.
Love it. Love it. So I think from a mind, body, lifestyle, also be cautious, guys, because a lot of times people will drink alcohol thinking that they're helping themselves. And really what it does is it suppresses it a little and then it comes back stronger. And then they end up stuck with alcohol or with marijuana or whatever it is, the eating. And that's where just stuffing it down with these things that we get addicted to, we got to be careful of. Even though in the moment people feel a little bit better, but let's go into people want to hear about supplements, although supplements don't cure diseases. Let's get into supplements. So let's do like a rapid fire. So
Rapid
I'll
fire.
I'll go over. I'm going to give you some scenarios, and you tell me what supplements may help. So
Not
scenario.
medical advice, people.
This is not medical advice. This is entertainment. If you use this for medical advice, then obviously you didn't listen to this piece. All right, ready. Cortisol levels high. What do you do? Well, what supplement may help? What supplement comes to mind?
I love Cortisol Calm by Pure Encapsulations.
Okay. And so what is in it?
Yeah, so it has a variety of different adaptogens. The big thing that I'm actually looking for, any of those cortisol supplements are great, adrenal supplements. However, you want to make sure they don't have adrenal like bovine in them or licorice because those will raise cortisol. So any of the ones that kind of lower it can be really helpful. Ashwagandha, L-theanine, stuff like that.
So to me, when I hear it high, phosphatidylserine, I think
Yes,
about,
that's
especially when I see it
too.
high, phosphatidylserine can actually lower it. It may take a couple of days. Before we forget, like you talked about the people that wake up anxious, a lot of times those guys have sleep apnea. Make sure you're checking that out, right? So the second, okay, what happens? You have a patient that has high cortisol, kind of like a flatline cortisol, and then at nighttime cortisol is high. What supplement do you think about?
So I will use the phosphatidylserine most of the time in the
Okay.
evening. And again, some of those other ones, but I'll just use it at that time. I
Okay.
also love a good magnesium. Melatonin can be helpful too.
So overall, just they're anxious, try some magnesium. What types of magnesium do you use and why?
My favorite is magnesium glycinate. So if someone's constipated, magnesium citrate, different story.
Yeah.
Magnesium glycinate is my go-to. Magnesium glycinate, magnesium threonate, I think are the top ones in terms
Mm.
of research of how they're absorbed, that kind of thing. I like glycinate better because I think it helps more with sleep, anxiety in general. Also, a lot of in my experience, that people will say that magnesium threonate crosses the blood-brain barrier better. I don't really find that there's that big of a difference, and I find just as many benefits, and it's cheaper than magnesium threonate.
Agreed. And glycinate has glycine, and glycine can cause the nervous system. So these chelating agents that are magnesium's bound to is doing two things. It's not only helping drive it into the blood or crossing the blood-brain barrier, helping us absorb it, but whatever it's chelated to can have an added benefit. So why not add that added benefit? So if they're having a lot of like palpitations and anxiety symptoms and you're giving mag, add the glycine. So mag glycinate. Mag malate I usually give if they have a lot of pain because of mitochondrial stuff, because
Yep.
that malic acid is used for the Krebs cycle. And sometimes I'll give like a mag glycinate and a mag malate 3 times a day in the beginning. It could take 3 to 4 months to get that magnesium level high, and then they can back off on the dose. All right, when you see thyroid being off. TSH is fine, but like reverse T3 is high, T3 is low. What does that make you think?
I'm thinking about particularly one, the stress, like you mentioned, why is reverse T3 high, and why are we not converting T4 to T3 well? Are we missing some of those cofactors? So
Right.
thinking about certain nutrients, I see a lot of benefit. I'll have people do 2 Brazil nuts a day. They get their full daily dose of selenium. I'll have them add in some natural sources of iodine. I'm not really big on like supplementing with iodine all the time.
Right.
Next research there, but getting like kelp granules or seaweed snacks or shellfish in their diet can be really helpful. And then,
Yeah.
there are good like thyroid support supplements that can be helpful, making sure their vitamin D, vitamin A, all those good nutrients, B vitamins and stuff are appropriate. And when we can kind of balance those nutrient levels, a lot of times that'll help as we do all the other
And
things.
back to the problem with giving iodine, they could have a hidden Graves' disease, and you can put them into the thyroid can shoot too high up, and that's why for those practitioners and for those of you at home, don't start taking even kelp and stuff like that. Don't start upping your iodine without your practitioner checking and making sure your thyroid's okay. And if I put somebody on an iodine, I'm gonna in about 3 to 4 weeks, I'm gonna recheck their thyroid levels, make sure it's not shooting up. All right, I think about ashwagandha. When I see reverse T3 high, my first thing is ashwagandha because ashwagandha helps with stress, but it also has been found to help with thyroid numbers. All right, what else do we have? We talked about cortisol. We talked about, let's just talk about, and then I think we're running out of time here for this section of the show.
Wait, I have
Um,
2 more supplements that I love for anxiety really quick.
yeah,
One,
and if you put promo code, no, just kidding, Everest 25, we will give them to you. No, what are they? What are the twos? Free today,
L-theanine.
freebie, guys.
Yes, L-theanine can be super helpful. I'll use it
Yes.
about like 400 milligrams twice a day or 200 milligrams, 3, 4 times a day. That can be helpful. And then,
So then that you can use for acute. So I was going to say, all right, let's talk about the acute
oh
ones.
yeah,
So acute L-theanine, you can take you sometimes do like regularly, right?
yep. But
And
you
then
can use it
sometimes
as needed. Yeah, like
yes,
you said. So that's my go-to for acute. And then there are some like blends that have that and some other things. Sometimes 5-HTP can be helpful because it'll give you that serotonin if someone has responded well to antidepressants and stuff in the past. But be careful not to use that when somebody's on antidepressants
yes.
because of that serotonin syndrome risk. Just kind of one of those
For for
CYA.
those of you at home, the way that our body gets serotonin is it takes the amino acid tryptophan and it turns it into 5-HTP. 5-HTP can cross into the blood-brain barrier because serotonin can't cross in, and that 5-HTP becomes serotonin. And if your serotonin is low, then that can cause anxiety, that can cause pain, that can cause depression. So we'll sometimes give the 5-HTP, but like Everest said, you don't do it. I mean, you be careful if they're already on an antidepressant, make sure you talk to your practitioner. Basically, this kind of using supplement stuff, talk to your practitioner, somebody that knows what they're doing and knows your personal makeup, your personalized imbalances. So 5-HTP more for a long acting. Sometimes I usually don't use it much for short acting. Do you?
No, not really. I would do more L-theanine there.
What about GABA?
I use GABA not super often actually because it can affect your body's ability to produce GABA, but I think for acute short acting, yes, it can be very helpful.
Yeah.
Long
And
term,
for me, there's debate over whether it crosses the blood-brain barrier or not.
yeah,
Um, so I think people might just have leaky brains, so some of it crosses. But I think about GABA as an add-on, especially if they're having like palpitations or they're having shakes. I find that some people it works really well for. And we'll do mixes. So like we have our own supplement line, the Dr. Yusor, and we private label, and we have one called Commax that mixes all those together that we'll use.
yeah.
All right. I think that's good for
Wait, I
acute.
have my last, can I tell my last favorite one lately?
They are just, man, this show, they are
Yeah, you
definitely,
guys are really lucking out.
oh,
This
they
is
are lucking
not,
out. They are lucking. And I not only want to hear it, I want to hear when you heard about it.
ooh, okay. So this is not acute. This is actually more chronic, preventative, and almost every mental health condition, pending they have no contraindications or anything, but amino acids, a good amino acid powder can make a world of difference. Anxiety, depression, eating disorders, ADHD. I heard about it Probably a year ago from the great Dr. James Greenblatt, who has a functional psych training program. And then I started to get into the research, but especially if you have those like pescatarian, vegetarian clients, but even not, because a lot of people who do, I've seen people do I love collagen, but so much collagen that collagen is missing some amino acids and including L-tryptophan, and they can get a depletion of it and it can cause anxiety. So if we can supplement with a complete amino acid complex or make sure you're really getting that from diet, it can go a long way.
And I'll just add to that. So when you have those amino acids floating around, when people exercise, then their branched chain amino acids, leucine, isoleucine, valine, and other amino acids that are needed for muscle are driven into the muscle. And when that happens, your tryptophan levels boost. And when tryptophan levels boost, that becomes serotonin that can enter the brain. So if I could get somebody on a walking program, but the caution is don't use exercise as your only way of dealing with anxiety, because then you get hurt, or you over exercise, then you get hurt, and then you're stuck. So I think, Everest, that was a great overview, a great getting our feet wet with anxiety and functional medicine. And now it's time to spill those functional medicine organic beans. We're going to get into the experience share, the things that you can't learn just from Googling or ChatGPT. As a matter of fact, the stuff we just did, you can't learn from Google and ChatGPT. It'll confuse you so much. To unlock additional premium content, including the deeper dive in this clinical topic, leadership and speaking tips, charting and efficiency pearls, and business mastery as a functional medicine practitioner champion, be sure to check out our mastermind and other membership programs at www.fmpessentials.com. Hey everyone, we hope you're enjoying the FMP Essentials show so far. Pretty amazing, isn't it? Remember, if you're part of our mastermind, don't miss out on our exclusive bonus clinical content. That's where we take a deeper dive look at personal experiences and real-world insights that you can't just get from a book or from looking on AI. It's where we really get into the nuances that make a difference in your practice, the experience of the guest of our show. Thank you for watching, and we hope you enjoy the rest of the show. Hello, everybody. Welcome back to the FMP Essentials show. We had some cool behind-the-scenes content for those of you practitioners that are members, that are part of our mastermind. Make sure you check it out, fmpessentials.com. It is sold out, so get on that waiting list. That being said, now is one of my favorite parts of the show, and that is giving back. And when we look at the functional medicine practitioner as a fruit-bearing tree, the fruit has seeds, and the seeds are planted to make more trees. So we strongly believe in giving back and creating legacy. Once again, the show is not only for functional medicine practitioners, it's for people that are practitioners of any type of healthcare practitioner, whether you're a massage therapist, or you're a chiropractor, or a nurse practitioner, a PA, a physician, anybody that deals with healthcare. Make sure you work within your license, but understand how the body works. This also, I want to remind you also, this show is for people that are interested in a career. So you have those family members that are not knowing what they want to do career-wise. Introduce them to the show, share the episode, because maybe they'll like the functional medicine way of looking at things, and then they'll get into healthcare and helping people with that approach. We have therapists that are functional medicine therapists. So, and also the show is for the champion, the functional medicine champion, the person that just loves root cause and thinks that this is the way that medicine should be. Everest, before we start, tell me what you're excited about. What are you working on right now that you're pretty excited about?
I am actually working on, it's very early, but hopefully a functional medicine higher level of care for mental health disorders. So
Tell us more.
well, I can't tell you too much more yet, but I feel like a lot of, we think about higher level of care in psychiatry, whether it's like partial hospitalization or even residential, and there's really not a lot of functional approaches in that world. So where I'm working with some people trying to build an option for that. There are a couple out there, none local here. I'm in Dallas, and then I also am just working on expanding education. So how I can kind of help train some functional psych providers.
You know, there's no secrets between us and the guests of the FMP Essentials show, right? I'm
I
just kidding. Oh, we actually talked about boundaries.
boundaries, yes.
Behind the scenes, we talked
Boundaries.
about boundaries. So how excited are you? Scale of 1 to 10.
I'm 11. I'm very
Nice, nice. Can't wait to hear that. Actually, it might be out there by the time we air this show. So we might be able to see that. So guys, make sure you look her up and figure that piece out. Everest, what are some impactful ways that practitioners can contribute to the community and give back?
I really think education is one of the biggest things. So ways you can use that to contribute to more than just your patients is like hosting, and you can do all of these things free as like a way to really give back of like hosting local workshops or going into schools and educating parents or students how to, implement different lifestyle factors. Providing, if you're in the mental health world, like providing resources, free resources for the community on mental wellness. And volunteering as well. So there's a lot of things you can do locally to really help community members learn the things that you tell your patients.
And are there any particular organizations that are non-for-profit that you feel like really help the functional medicine cause, the personalized cause that you would say people could donate to?
Yeah, I'm really involved in a lot of like mental health specific ones in general too. I would say there also is an organization that I've been involved with called I am for US. It's Institute or Integrative Medicine for the Underserved. And they do a lot in general of like working implementing functional medicine in underserved communities. So that's a great one. Locally, I think a lot of communities have like the Boys and Girls Club. Salvation Army does a lot, even with blood donations and way more than that. And then I'm really involved. I love like the Trevor Project as well, which is like more in terms of suicide prevention. I know you're doing a topic on suicide coming up, so that can be a really great one. And then some like local organizations there. I just went to an event for one called CARE, which is helping educate on like addiction in the community and stuff like that.
Nice, nice. So, yeah, as you guys see at home, we are functional medicine practitioners. We are about giving back as well, right? Functional medicine practitioners do need to pay the bills, so they got to get paid for what they do. But they also, the ones that I know, joined not because of any business reasons, but because the ones that I associate with, that I'm friends with, they are about giving back and in various ways. So thank you for Everest for those little pearls and tips. How do people stay connected with you?
Yeah, so you guys can follow me on Instagram. I'm Wellness with Everest. You can reach out to me that way. You can also go to my main website, which is everestfunctionalpsychandwellness.com. And feel free to reach out, connect. I love connecting with all of you guys, and I love that you're here, and thanks for having me.
Everest, it's been my pleasure and their pleasure. You have been so generous with your time. I can tell your patients are extremely fortunate because you can tell the amount you care about them, that you're willing to dig and figure things out and be on that journey with them. It really shows. It shows in your personality. It actually shows more in person. So people get to catch you in one of those lectures in person. Make sure you follow her Instagram, check out her website. Everest, thank you for coming on.
Well, thank you for having me, and hope to talk to you guys again soon.
Bye-bye. Hey everyone, I'm Dr. Yousef Elyaman. We hope you enjoyed the show. For more exclusive content from this interview, check out our FMP Essentials Mastermind. Make sure you check out our website at www.fmpessentials.com for our blog and other content. If you enjoy this show, please subscribe. Give us a like. It helps way more than you could imagine. Thank you for watching. Follow us across all social media platforms at FMP Essentials HQ. Please don't forget to share this with your practitioner friends, and we'll see you in the next episode.